Good evening. Is the microphone working? Okay, good. Welcome. Welcome to everyone. Hope you all enjoyed the second day of spring. It sort of looked like spring out there this year compared to the last several years. I heard yesterday evening that the temperature yesterday for the first day of spring was the warmest it's been for about 5 years now. So maybe that's a good sign to come, and spring will stay this time. So just like to say welcome to everyone. It's so nice to see so many familiar faces here. And it's also so nice to see faces of family members to join us here this evening. My name is Mark Dennis. I am the General Manager for St. Barnabas Communities. On behalf of St. Barnabas Communities and St. Barnabas Clinical Service, welcome to the St. Barnabas Continuum of Care. Family Matters. By the end of this evening, we hope that you will leave here with a lot of useful information and a better understanding of the resources, amenities, benefits available to you through St. Barnabas Health System. I have a few colleagues here with me this evening that will be sharing a lot of information with you. They are Kathleen Brenneman. I think just about everybody here knows Kathleen. Kathleen is a Director of Resident Relations at St. Barnabas Communities. We also have Bill Hayes, gentleman back here. Bill is the Director of Security for St. Barnabas Health System. Stephanie Howe. Stephanie is also to my right. Stephanie is the Clinical Liaison for St. Barnabas Medical Center. Gwen Whitford. Gwen is back here as well. Gwen is the Director of St. Barnabas Medical Center's Home Care. Last but certainly not least, Ann Nelson. Ann is the Director of Clinical Admissions for St. Barnabas Health System. I am now going to hand the microphone over to Kathleen. Thank you.
Thank you, Mark. It's so nice to be here tonight. It's so nice to see so many familiar faces and to see some family members whom I know, and I'm looking forward to getting to know others of you tonight. Kind of the rationale for this program, my coworker Ann Nelson and I a couple years ago began meeting with family members one-on-one, and we came to the realization that even though you've moved here to the village or the Woodlands or the Washington Place, you actually might not know that much about the services available to you right in your independent living setting to help you stay here, or you might not realize all the services that are available throughout our continuum of care. So we thought there was a real need and a real opportunity to provide some information and education to you. Plus, we're going to have dessert afterwards. So really, this is basically just an excuse to get together and have dessert following. So, but this is a continuum of care, as we said on the invitation. And you know what a continuum looks like. Our continuum is like this. Here you are in independent living, and we can't even call this really a care setting. You're just here in your apartment doing your thing, having some fun. But you do have access to St. Barnabas Medical Center and the services from the medical center, home care, the doctor's offices, the dentist, all of those kind of things can be added into your independent living setting. And then you have assisted living, what we call living assistance at the Arbors, and Ann will talk a little bit about that. And then you have skilled nursing through St. Barnabas Nursing Home and Valencia Woods at St. Barnabas. What in the old days we called nursing homes. Today we like to refer to those as skilled nursing facilities. So that continuum looks so nice and orderly, and you just progress through that just as your needs progress, right? well, next slide. This is more like what real life looks like, a big old hairy mess where, maybe something happens and you need to go to the nursing home for a while for rehab, and then you get better and you come back to your apartment with home care, and then something else happens and back you go to the nursing home, and then maybe you need assisted living. So that continuum of care can have a lot of back and forth in it, and that's part of what makes it so hard to kind of figure out where you need to be in it. One thing I want to reassure all of you, though, is just because you're here and part of a health system, you may never need to use the other parts, the other facilities within our organization. Using last year as an example at the Village, of the 45 apartments that turned over, only about half of the people in those apartments needed to move to a higher level of care. The other half lived out the rest of their life expectancy right in their own apartment, or in a few cases, some of them opted to move in with family members. But it doesn't just automatically mean because you're part of St. Barnabas and part of the health system that someday you're destined for one of our skilled nursing facilities or one of our assisted living facilities. We want to do as much as we can do to keep you right here at your apartment in independent living. We want to do that because we think that's what you want to do. I don't think any of you want to move to a nursing home today or tomorrow. Am I right? Fred's shaking his head yes, so I'm going to take that as a yes. One of the things we do, we have a lot of amenities here at the Village. Next slide, Mark. One of the things, go on to the next one. Okay, so here we're picking on poor Ruth and Hazel. But one of the things we really believe in at the Village is laughter is the best medicine. So we do a lot of fun things. We're really proud of our recreational programming here at the Village and the Washington Place and the Woodlands. We have everything, Pam, our former recreation director, used to always say, we have everything from Bible study to bingo. So we have trips to the casino, we have card nights, we have cocktail parties. There's all kinds of things to keep you active and engaged. There's study after study today that says the more time you spend socializing and engaging with others, the better your quality of life is going to be and the better your health is going to be. So we really, really endorse recreation. Okay, next slide. We have a dining program for lunch and dinner. Certainly, we have lunch and dinner available in the pub, the restaurant, the leisure lounge. What you may not realize is that you can have meals delivered to your apartment. All you have to do is call between 3 and 3:30, and we will deliver meals to you in your apartment. At the Washington Place, the hostesses deliver. And there's information on your packet about the number to call, and there is a $3 fee for the delivery, and that's because we really do try to encourage you to come down for dinner and socialize with others. Okay, next slide. Housekeeping. You all probably realize we have housekeeping available here at the Village. All of your contracts include one housekeeping service a month. If you need additional, you can order that a la carte. It's just $17 an hour. Maybe you need housekeeping to help you clean out your refrigerator more than that once a month, or maybe you need your linens changed. So those are some of the things housekeeping can do for you beyond that once a month. Okay. Transportation. So many of our residents no longer drive, or they drive very little. So we have the Barnabas, and I think everyone here loves our drivers, am I right? Everybody is a big fan of Charlie in particular, our longtime bus driver. But we provide scheduled bus trips to Shop and Save, Walmart, Giant Eagle. We have out to dinner and out to lunch programs. We can shuttle you to appointments at the medical center, or if you have a loved one in one of our other facilities, we can shuttle you there. If you need to go somewhere where our shuttle bus does not go, we can help you sign up for Allegheny County Access, and we can also provide information to you on some commercial services, some shuttle services in the area, quality transportation, and some other types of services. We have information in our office we can provide to you. Okay. If you are still driving, these two gentlemen, John and Chris Rudolph, they operate Rudolph Auto Repair, which is located on Route 910, just about 3 miles away. The big convenience to you, our residents, is John and Chris and their team members can come out here to the village, pick up your car, take it to their shop, diagnose it, give you a call with the cost of what your repairs would be, and then return it to you. Rudolph's also is a full-service gas station, so on those cold wintry days when you don't want to get out and pump your own gas, they can do that for you. They do state inspections and oil changes as well as a full array of repairs. Very good service. Next slide. This is very important. In fact, I have in your packets, I have a brochure for Life Alert. You can use any service provider you like, but if you are someone that you think you might be at risk of falling or having some sort of medical problem where you need to get help right away, the Life Alert button or Medical Alert is a great tool for you, and we highly recommend that you subscribe to one. You would just call the company, have them come out or ship the product to you, attach it to your phone, and what we recommend you do is you program it to call St. Barnabas Security. That way we can get a security officer to help you. Maybe you don't need an ambulance, but you just need some help getting to your feet. So those are a very, very helpful tool that can help you stay in your home. And a lot of the devices these days, they've come a long way. They can even detect if a person falls, and they're remarkably accurate. So that's a good way to enhance your security. And security is truly one of the best things we have here at the Village in the Washington Place and the Woodlands. And to tell you a little bit more about our security program, I'd like to invite my colleague Bill Hayes to come forward and fill you in a little bit more detail. Thank you all.
Good evening. Thank you, Kathy, and thank you for being here. As I said before, it's nice to see so many faces, and it's especially for us, it's nice to see unfamiliar faces. So we appreciate you being here, and thanks for your time. My name is Bill Hayes. I'm the Director of Security, and I've been with St. Barnabas for 15 years. Outside of St. Barnabas, I'm an active volunteer firefighter, and I have been for the last 28 years. Prior to coming to St. Barnabas, I was a police officer for 8 years. 4 of that was in the military. Our security staff here at St. Barnabas consists of 30 security officers. They're all trained in first aid, CPR, along with AEDs. We are here for your safety. I can't make it any simpler than that. We're here for you, and we want to be there for you if you would have an emergency. Back up one time. Here we have a picture of Jason Sylvia. Here at the Village, we have a security officer signed upstairs 24 hours a day, 7 days a week. That is a picture of our security desk upstairs. You can see that it's quite busy. There's a lot of cameras there, the telephone, computers and stuff like that. But we have 4 of those security desks. That allows more than one security officer to always be monitoring the cameras and stuff. It gives us eyes throughout the entire health system. Obviously, it gets quite busy there, but it allows us to be very, very efficient throughout the entire health system. Next is a picture of the supervisor, John Downey, with me there. That's 2 of the 3 vehicles that we have. John is a retired police lieutenant out of Du Bois area in Pennsylvania. We have 3 vehicles equipped with radios and the yellow lights that you see there. We're on patrol 24 hours a day, 7 days a week. Usually we have at least 2, if not 3 people patrolling the health system. They can be dispatched anywhere in the health system. They monitor the alarms from the vehicles themselves, and they're constantly on patrol checking our vacant or closed buildings, if you will, at night. Communication and preparation are very important. If you have a cell phone with you, I would ask that you program our telephone number. This number is very, very important. This will be the number that you'll call if you need security for whatever reason, 724-444-5598. Please take a moment to program that into your phone, and when you return to your apartment tonight, please make sure you keep this number close by to your phone so that in case you need it. Also, when you get back to your apartment, if you haven't noticed, there are pull cords in your bathrooms and in your bedrooms. Those pull cords ring directly to the security desk in the village building, so that if you need any type of medical help, you just pull that and it rings directly to security and we'll be there. Preparation can go a long way, especially when you have an emergency. Please make sure you keep your medication card on your refrigerator. There's a nice picture of the one. We ask that you keep it there. It's very important that it's there, and it's very important that it's updated. But this way we'll know the medications that you're on. It asks for your allergies. This is all the information that we turn over to the paramedics so that they can treat you and take care of you. Also, we need you to keep your information current on your white emergency card. We keep those at the security desk, and any time that we respond on an emergency, we'll bring it. During an emergency is not the time to find out that we can't get in touch with your family, or it's not the time for us to be looking for your medications. If we have all that information up front and we have it and it's already prepared, it makes everything much more quicker and efficient for you. The community's office with Kathy, they have those cards on hand, so as things change and as things get updated, if you need to make changes, by all means you can go down there or stop at the security desk and we'll get you one. Speaking of emergencies, I already give you our phone number and ask that you program it into your phones. Again, 724-444-5598. We answer that 24 hours a day, 7 days a week. We're always here for you. But we'll be happy to call 911 for you if we need to. But if you choose that you want to do it on your own, by yourself, that's perfectly fine. We just ask that then you call and give us the heads up as soon as you can afterwards. As soon as we get the call and as soon as we make the call, we'll be there to assist you, and we'll do what we can and get you prepared for the paramedics. As I said before, we're here for you, but we need your help. We need you to help us so we can help you. A little bit of preparation on your part, a little bit of communication goes a long way, especially on your worst day, and so that's what we're here for. Okay, our next speaker will be the lovely, I've been paid to say that, the lovely Stephanie Howell will be up here.
And that was the charming Bill Hayes, everyone. How is everyone tonight? Good. Thank you so much for coming. We greatly appreciate it. For those of you who just joined us, my name is Stephanie Howell. I'm the clinical liaison here for the St. Barnabas Medical Center. I've been here 5 years at St. Barnabas. And what that means to you is I can actually perform well checks on any of your loved ones. I'm available to provide these well checks by the request of staff that might have a concern over one of our residents, or potentially even just friends or concerned family. My phone number is in that packet, and you can use it anytime. Sometimes I'll answer. And you can just give me a call, and I'll be happy to check on your loved one for you. One of my main goals here at St. Barnabas is to forge a relationship between the physicians here at St. Barnabas, as well as the community physicians, as well as even within the hospitals. Passavant Hospital seems to be the main hospital that our folks like to go to, but we also cover Allegheny General Hospital or any of the Highmark. We have no affiliation to any of the UPMC or Allegheny Health Network, but we can see you at any of those places. Myself and the other clinical liaison, her name is Erica. She can visit you in the hospital and let you, and if you're comfortable, you can please give us a phone call to let us know of any scheduled or unscheduled hospital visit. Many times we can be of assistance if you're in need of communicating with the hospital staff and addressing the potential needs, maybe with follow-up for doctor's appointments, lab work, something like that. If you need a level of, maybe a higher level of care for just a temporary time, we can help direct the best skilled nursing or a rehab stay for you. Our goal is to have you age in place here at the village because we know that is what you want. But if for some reason you need to go somewhere else temporarily, we want to make sure you go to the place that's most appropriate for the care that you need. My office is located right next door at the medical center. I spend my days visiting with our residents to assess their current health situation. When necessary, I can help them set up appointments at the wider range of services that are offered here at St. Barnabas. We can even provide free door-to-door transportation with the Barnabas. And I want to go over some of the physician services that we have, because a lot of folks don't realize how many things we offer, and it's not just for our residents, it's for family members, it's for staff. So anyone in the community can go to any of our physicians. And there's actually a list in your packet of all the physicians, but we'll quickly go through those now. Starting with our dental department, here at St. Barnabas, we do offer state-of-the-art dentistry to patients of all ages, including children. My own kids go to the dentist here, and they actually like him. So that's hard to find. So the Family Dental Office is located at the Medical Center. It offers free oral exams for our residents. So I'll repeat that. So if you're a resident here within St. Barnabas, you get a free dental exam every calendar year. Along with our dental exams, we do routine cleanings, x-rays, fillings, crowns, tooth extractions. Our dental department is on call 24/7. Patients can be seen the same day for emergencies. So if you have a dental emergency and it's on a weekend or it's late at night, please call the dental office and someone will call you back. We also have a prostodontist. That's Dr. Backery right there in the picture. That means dentures, basically. A prostodontist is someone who specializes in dentures, bridges, even implants. So he is also available to anyone in our community as well as the residents here. Next, I'll talk about our physicians. We do have a general medicine office in the same building as the dental office, which is the medical center. Their hours are Monday through Friday, 8:30 to 5:30. The medical office offers internal medicine services to our residents, staff, neighboring community. Our team of doctors provide physicals and routine health screenings, medication management, acute illness care, and chronic disease management. Our clinicians are as well on call 24/7. So if you do have an evening emergency or a weekend, you can call the number for the medical center. But of course, if it's an acute illness or something, you need to call our security office as well as 911. But our doctor's office is available for any questions that you need 24/7. Now I'm going to cover some of our specialists that I don't know if everyone is aware of that we have at our medical center. We have a rheumatologist. He sees patients twice a month here at the medical center. He treats all types of arthritis ailments, musculoskeletal diseases. He can provide pain management relief with joint injections. Some of our residents here have had great pain relief with a knee injection, maybe every 3 or 4 months. So if that's something that you have some aches and pains, we do have a rheumatologist on staff. We have an optometrist, provides comprehensive eye care, does routine exams for patients, also can do minor repair on your eyeglasses. There's a podiatrist on site. They can treat anyone with maybe diabetic or vascular care needs, as well as assess issues with your feet, your ankles, your toes. Something as simple as toenail clipping. We forget how tough that can be sometimes, so they can provide that service for you. So our next physician that we have here on staff at St. Barnabas is we have a cardiologist, and they're here every other Monday, and they specialize obviously in the treatment or prevention of heart disease, and they can help manage maybe your medications or any questions you have. We have an audiologist who treats hearing, balance, and auditory disorders at the medical center. She also offers battery maintenance and repairs on existing hearing aids. So we have an acupuncturist here at St. Barnabas, and it's become very popular. We used to staff 1 time a week, and now they're up to 2 days a week. It's a very, very popular service. And our acupuncturist practices under the tradition of alternative medicine that utilizes those tiny needles to restore balance and blood flow to your system. His holistic approach includes a full assessment of the patient's ailments and tries to treat all of them, not just one specific issue. Along with that, we have a massage therapist on staff, and she's a licensed geriatric masseuse. She sees clients in your homes here at the Village or at Washington Place, and then she also has an office in the medical center. She can help with circulation or muscle tightness, maybe back or shoulder pain, and she'll do a full assessment of the patient's health problems before beginning any type of therapy. And our final slide for myself is, let's see, just an overall general for the medical center. Just a reminder that it's a convenient place for maybe lab work, maybe a blood pressure check or blood sugar. And we also do B12 shots, allergy shots, vaccinations for flu and pneumonia. We do flu vaccines here at the village, but if you miss it, you can always go to our medical center for a flu shot. And your health is definitely, of the utmost importance to us. Our goal is to assist you to aging in place within your own home. And please don't hesitate at any time to call with any questions that you might have. And I'll be available after for any questions as well. And at this time, I'd like to turn the presentation over to Gwen Whitford. The lovely Gwen Whitford.
Thank you. Hi, good evening, everyone. As Stephanie said, my name is Gwen Whiteford, and I am the Director of Home Care here for St. Barnabas. I have been with St. Barnabas for 17 years. 14 of those years, I have been the Director of Rehab Services for the health system, and I've recently taken over the role as Director of Home Care. Our home care department can be very instrumental in helping to provide you with the care that you need to stay at the village for as long as possible. Through our home care department, we provide nursing visits in your home. We have registered nurses that can see you in your home to address an array of medical issues that you may be having. This includes medical care and care for illnesses such as CHF, COPD, diabetes, and heart disease. We can also assist with wound care, IVs, and medication management. We provide physical therapy services. Our PTs and PT assistants will see you directly in your home. They primarily work with lower body exercises and strengthening, as well as ambulation and transfers. And they can tailor a home exercise program for you to do on your own here at the village. We also provide occupational therapy services. So our OTs and our OT assistants will also see you in your home. They work on upper body strengthening, and they train you to be as independent as possible with bathing, dressing, grooming, hygiene, meal preparation, laundry, and all other activities of daily living. We also provide speech therapy services. Our speech language pathologist will work with you if you're having swallowing difficulties with your meals, cognition, problem solving, word retrieval, oral motor strengthening, and difficulty with overall communication. We provide home health aides as well through our home care department, and they can assist you with any bathing or hygiene needs that you may have. We also offer private duty care. We have home health aides and home care companions that can come to spend time with you daily, weekly, or monthly, depending on your needs. They can assist with bathing, toileting, transfers, light housekeeping services, assisting with cleaning and laundry, as well as quick checks for blood pressure readings and supervision with taking medications. We also offer private duty nurses who can assist with more complex medical issues requiring nursing attention, such as blood draws, glucose monitoring, administration of medications, and pre-pouring of weekly medications. At St. Barnabas Home Care, we also offer palliative care, which is a specialized form of health care used to support the needs that people are facing with progressive illness. This unique medical approach focuses on managing the patient's symptoms and effectively enhancing the quality of life. We also provide hospice care through St. Barnabas. Support services can be provided in your apartment as long as a qualified caregiver is present. Services can also be provided in our skilled nursing facilities or in our living assistance. Hospice includes symptom and pain management during a terminal illness. The care team includes nurses, aides, a social worker, spiritual support, and volunteers. And hospice is covered by Medicare if over age 65. Through the St. Barnabas Home Care Department, we can address all of your health care needs right in your own apartment without needing to leave. The skilled home care services are covered by your insurance, and we do accept most major medical insurance plans. We have pricing options available for our private duty services as well. St. Barnabas Medical Center also has an outpatient therapy department, which is located at the medical center in the lower level. In our rehab department, we also provide physical, occupational, and speech therapy services there. This type of therapy is ideal for residents who walk well, can easily leave their home with little to no assistance, and can easily get on and off the Barnabas for scheduled appointments. Our therapy sessions are scheduled approximately 2 times a week, and they are usually around 45 to 60 minutes per session. These therapy services must be prescribed by a doctor, and there will be co-payments associated with these services. We are considered a specialist if you would be trying to determine what your co-payment would be for outpatient therapy services. And lastly, we also provide aquatherapy services on an outpatient basis at our heated pool at the Crystal Conservatories. The sessions are completed with our physical and occupational therapists and therapy assistants. They're conducted one-on-one, and no one else uses the pool during the therapy sessions. The sessions range from 30 to 60 minutes, depending on the level of participation by the patient. A doctor's prescription is also needed for the aquatherapy services. A land evaluation takes place at the medical center prior to initiating the pool plan of care. So as you can see, we offer many ways to keep up your strength and endurance while living strongly at the Village. Next, I would like to introduce Ann Nelson, our Director of Clinical Admissions.
Good evening. It's very good to be here this evening, and so nice to see so many residents and family members. Kathy and I have been used to doing this one-on-one with just 1 or 2 residents, so it's wonderful to have a good audience and catch a lot of people at the same time. I've worked as the clinical admissions director here for almost 12 years, and I've had the honor of helping many families and residents with their care needs for their loved ones. So far, you've heard a lot of good information about how to stay independent. You're probably on overload already. It's so wonderful to have so many support services here, but understand that there may become a time when you may need not able to stay independent any longer. And how do you know when you might need more help? St. Barnabas is here to help you offer living assistance. One of the ways you know that you might need more help is if your loved one finds it harder to prepare meals or managing their meal schedule. Maybe they've lost weight due to irregular eating habits. Maybe you need help to order your medications or keep track of your complex medication schedule. Maybe you're more unsteady on your feet, have had some falls, need help to get out of a chair or to the bathroom. You can't get your shoes on or manage your buttons without assistance. Or maybe you're just reluctant to be alone in your own apartment. You generally need unscheduled help on a routine daily basis. Perhaps your loved one has trouble remembering what they have done during the day or has had changes in their memory. He or she might be frequently unaware of their surroundings or had a wandering episode due to a cognitive decline. Are you dealing with more complex medical concerns such as diabetic care, oxygen management, blood pressure regulation, or vision impairment? We assist you as you need to transfer within the system to find the appropriate financial and care options. The admissions team works with you to find the right place at the right time. St. Barnabas now has 4 living assistance residents. Each is a unique setting with similar care and amenities. All are beautifully decorated and comfortably decorated. The 3 Arbors residents are on our Gibsonia and our Valencia campuses here. They offer a variety of suites for those who want more space, even larger 1 and 2 bedroom suites. They all have a kitchenette to keep your favorite snacks, a washer dryer. Some even have a fireplace. St. Barnabas has expanded into Beaver County, and when we acquired Beaver Meadows about 2 years ago now. So we are now tri-county operation. At the Arbors, you will enjoy 3 daily meals, each with personalized choices, weekly housekeeping and linen service. Staff is available round the clock for scheduled and unscheduled needs, such as assistance with activities of daily living, which means getting dressed, getting a shower, maybe daily hygiene, helping you shave. Medical care they can provide as well. They can provide help with mobility, transferring, helping you get up and down out of a chair, or walking with you when you're walking with your walker and maybe a little unsteady. They also do medication management. We can order the meds. We keep them in our med room with the nurses, and you don't even have to worry about it. We coordinate with your doctor so that you know that we have the right medicine for you at the right time. There's also a variety of social activities, which is a favorite thing. I know here at the Village there's many things to do, and at the Arbors there are too. Most importantly, the Arbors offers you peace of mind. There may be a time when you or your loved one needs temporary care. The Arbors can provide a respite stay for several days or up to a month while you recover from surgery, get stronger after rehab, or a caregiver needs a break. This is like a bed and breakfast with help. St. Barnabas is focusing on memory care at many levels. Our specialty care director has trained staff in all of our residences to follow the Alzheimer's Association habilitation model. A gated memory care community in Arbors 3 and in the St. Barnabas Nursing Home offers a secure and safe environment. And an additional memory support program is offered at the Arbors Valencia. Due to the program's success in the other areas and the fact that we keep full quite a bit, and we want to make sure we have the options that everybody needs when they need them. Support groups for spouses of Village and Washington Place residents are offered monthly, as well as cognitive therapy and one-on-one consultations. Sometimes a more serious illness or healthcare concern arises that results in a hospital stay. I think this has been talked about. Stephanie mentioned this and Kathy did as well. Please let us know so that our staff can support you through this situation to determine how St. Barnabas can meet your needs. Erica Rusick is our clinical liaison who will follow you in the hospital if you want her to do that, help coordinate your care with the social worker there, works with your family to facilitate a move back to short-term rehab at the St. Barnabas Nursing Home or Valencia Woods. And on the slide you see pictures of some of our rooms that are offered there. We have one-on-one physical, occupational, and speech therapy 7 days a week, and that provides consistent support for you. The length of stay, how long you will be in this short-term rehab setting, is determined by your health insurance and your progress. Our excellent care team and therapists work towards the goal to get you back home. Actually, the average length of stay in rehab is 2 to 3 weeks, with the majority of people being able to return back to their apartment here at the Village or Washington Place with our home care services, which is part of that continuum Kathy showed you where you're jumping from one part of our system to the other. If it's not possible that you can come back to your home, we look at other options within our system, such as living assistance or staying long-term care in one of our skilled nursing facilities. We want you to know that there are many, many caring people within the St. Barnabas community ready to help you and your loved one navigate their journey. We welcome communication with families and are honored to be part of your team. Now, Mark Dennis will come back. Thank you.
Thank you, Ann. There was a lot of information provided to you this evening, both from the speakers as well as the information that was handed out to you upon entrance tonight. I would like a round of applause for everybody that was up here providing that information. Before we adjourn for this evening and go across the mall for some delicious Barnabas Bakery goodies, we do have time for some questions from you all, residents, family members, please.
I hope this never happens, but what happens if you run out of money?
Okay. So the question is, what happens if you run out of money? And that's one of those, there's 1,000 different scenarios, 1,000 different circumstances. What we recommend, before that happens, when you kind of see the writing on the wall that maybe that could happen, come talk to Mark and me, and we will get updated financial information. We'll have that reviewed by our accounting department, and then we'll see where it goes from there. All of you, before you moved into the village, we looked at your finances. We made sure that you had enough to qualify for your life expectancy. So you're not going to be asked to leave. There's always going to be a place for you here within St. Barnabas Health System, whether that's in your independent living setting or whether you need to move to our long-term care setting. But we do work on a one-on-one basis in those situations. Okay? Other questions? That was very good. Thank you. Okay. I feel like we're ignoring these poor folks over here. Yes, sir.
Does the cost change moving from the village?
Yes. So St. Barnabas is what we call kind of a pay-as-you-go system. There are other types of models out there where you pay that large upfront entrance fee, but here, when you're in the independent living setting, you're paying for independent living. When you would go to the living assistance, you would pay for that level of care. Typically, if you're in the rehab, that's when your Medicare is going to be paying for you. And then if it becomes evident that you're going to run out of that, that's when you would be looking at vacating the apartment here at the village and then making a permanent move either to living assistance or the long-term care at one of the nursing homes. Okay? Other questions?